Well, the state health department is facing scrutiny after a grand jury report showed the agency misled the legislature about needing $30 million. The agency also unnecessarily cut jobs and services, according to the report.
And today, News 9's Capitol reporter Aaron Brilbeck sat down for an exclusive interview with the interim director to discuss where the agency goes from here. Aaron?
Yeah, the Department of Health manufactured a crisis and misled the legislature about a slush fund that led to massive cuts in both jobs and services. Well, today we sat down with the commissioner to find out more about why. To save money, the health department unnecessarily cut funding to certain services like child abuse prevention, saving roughly $900,000.
That $900,000 can only be used for child abuse prevention work. And so we have to figure out now the best way to deploy that money going forward.
Interim Health Commissioner Tom Bates says the $30 million in emergency funds granted by the legislature sits in an account untouched.
$30 million, that's a large sum of money. So the legislature isn't going to allow the health department to carry over $30 million, nor should they. So they will make that decision as to how the best way to utilize that money.
But your budget goes up this fiscal year. You got an increase.
It's basically a flat budget. We got an increase to take care of some the employee raises, the state employee raises.
As for the 198 employees that were laid off and the 231 that have since quit, the agency will try to get some back.
To make sure that those county health departments are delivering core health functions to our local communities.
What about the idea that there's some folks looking at a class action lawsuit based on these jobs?
You know, Aaron, I mean, people will pursue legal remedies that they have available. I'm not going to comment on that.
In looking at your background, it doesn't appear as though you meet any of the statutory requirements for this position.
Well, Aaron, I'm an interim commissioner, and you're right. The statute does require that a person with a medical background be the commissioner of health. They needed someone maybe with a little bit different expertise to guide the agency through this time period. So I'm here and I will do that until I'm told otherwise.
On the scene on the story at the state capitol, Aaron Brilbeck.